Live ulit tayo. Pakicheck nga kung naririnig mo. Oo, yan ang sakit ngayon eh. Kaya... Meron? Balik ulit tayo, no? Ang issue natin dito ngayon, ang pag-usapan, ito talagang ano natin, yung sa prostate. Tingnan natin kung nakikita ako. Nag-a-adjust. Wala akong sekretary nag-ano. Busy-busy sila eh. Ha? Tingnan ko kung prostate problem. Ayan. Ba't madilim? Ay, ano ba nangyari? Ito talaga yung ano ha. Continuation to ha. Aha. Ba't madilim? Mali na ba? Ayan. Siguro makikita nyo na yung... Okay, gumagana, no? Na-adjust ko pa. Na-adjust ko pa. Kasi natin sound. Okay. O, dito. Iano ko yung sa prostate, ha? Sige, ingat mo kayo, ha? Oo.
Sa Martes na lang po ako babalik.
Sige, Martes, balik kayo. Yung pasyente natin, ano? Ito. Pwede na ba ito? Lorraine, bigyan mo nga ako ng cellphone para nakikita ko kung ano ang yung cellphone na may YouTube channel. O, ito yung prostate natin, ano? Yung prostate, eto, normal yan, ano? Ito yung urinary bladder. Tingnan natin kung makikita. Kaya lang hindi ako, ano eh. Urinary bladder, naimbak ang ihi rito. Pupunta yan dyan. Ito ang nag-ano. Ang trabaho ng prostate, siya yung nagbabalance ng liquid, yung viscosity, yung lalaki may sperm. Doon sa testicle, ano, kailan pumunta muna ako ron. Sandali. Para nagkaintid. Kailan maunawaan nyo ng maigi to? O doon sa followers ko, no, please share ito dahil napakaraming may prostate dito ngayon para makatulong tayo sa mga tao, maiwasan nila. Sasabihin ko rito kung ano mga senyales na mga halimbawa, hindi naman kayo nagpapacheck, nagtatrabaho kung saan-saan. O, may mga senyales yan, palatandaan na ituturo ko sa inyo dito. Ano ba yan? Nawala na ata yung ano, kailan natin pumunta. Ayun, ito, ha? O, dapat pala, ano ko. Okay. Ito yung prostate. O, tingnan nyo nga. Sige, ito, dito na lang. Tingnan natin yung paano umiikot yung prostate. Malinaw ba? Check natin. Yung video kung malinaw yung nakikita. O, mukhang malinaw naman. I-share nyo ito, no? Baka mamaya yung magulang nyo, Wala kayong kamalay-malay. Ito na pala yung issue. Dahil dito, sasabihin ko sa inyo kung may sabit na yung prostate nyo. Pwede ako mabigyan ng ano rito? Cellphone para na ano ko. Ito yung male sex reproductive system. Ano? May tinatawag urinary bladder. Ito. Yung ihi natin, mula rito, dadaan dyan. Nakita nyo? Ayun. Lalabas siya. Sa ihi, dito na iimbak, ito yung urinary bladder. Ano? Pero naman, doon sa sperm naman, sa sex, ano? Pero doon sa sperm naman. Alisin natin yung sound. Alisin yung sound. Pahiram muna nito. Baka mamaya hindi ako nakikita ng malinaw eh. Ba't madilim ito? Lagyan mo nga ng ilaw ito para gusto ko malinaw. Napaka-importante itong pag-uusapan dahil hindi ako tinitigilan itong prostate eh. Para ibuksan mo ito. Please, i-share nyo ito. I-share nyo para maraming ano. Ano mo pa? Ang tawag nito? Ano para buksan mo yung ilaw na yan. Hindi, sarado. Sumisindi. O, tayo, maliwanag naman ako. Tingnan natin. So, pag nakaganyan ako, dali, tingnan natin. Kung hindi niyo ako gano'ng nakikita, ayun pala dapat. Okay? Urinary, ito yung urine natin dito mag-i-stack, ano? Pag nagkaroon na tayong urge para umihi, ayan, madidetect nung ano natin, utak, ayan. Tapos, pero dadaan tayo sa prostate. Nakita yung prostate ito. Ayan. Pag yan lumaki, magkakaroon ng restriction dito. Halimbawa, normal lang yan. Pupunta yung karon, kanon. Siya nagkukontrol, yung prostate, nagkukontrol ng paglabas ng urine at ng sperm. Siyang may kinalaman dyan. Halimbawa, ito yung urine, ilalak niya ito kasi yung ito yung ano testicle, ano, bayag ng tao. Testicle diyan. Look, may tube papunta ron. Oops, yun. Pupunta ron, no. So siya nagko-control, siya yung pinaka-yield check valve, ano. Pagka if the person need to release the urine, this will be closed. And the urine will pass through easily without a problem. How about the sperm? On the time of ejaculation, you know. This gallbladder will be closed here and the sperm from here. The sperm, it will release the sperm, go there, look, this is here, and then go. And then, but the sperm must be mixed with a little bit of liquid to make the viscosity good enough because the sperm was really, very sticky, That's the balance of the prostate is balancing the, how you call it, viscosity of the sperm. Sometimes produce liquid. To balance, there is some property here that, to make sure the sperm, a proper right balance of liquid and this sperm will create a very good output for our on the time of ejaculation. So that's the job. Pero once there is a problem on this organ, like now there's a tumor, sometimes expanded without the tumor but expanded, So there is a restriction. This restriction will limit the flow of the urine. Sometimes, when you are going to the toilet, you are always in a hurry. That's when there's a pressure already here, and then sometimes you don't yet finish unzipping your zipper, the fluid go out because of the pressure building up on this area. But sometimes when you're urinating, because of the restriction, there is a feeling, let's say the urine is going out, look like it's finished, but you can feel that there's something like remaining on this area, on your bladder, because of the restriction, because of enlargement of this, either by enlargement or by the tumor, So that's a problem. Always a retention urine retention on the bladder will create infection. So if as a man there's a UTI, urinary tract infection, it means commonly it's very high percentage there's a problem on the prostate. Actually, it's a serious because bacteria will flourish on this area. I need to explain it in English because there's a lot of requests that try my best to do it in Tagalog and English. I hope you understand because YouTube, my subscriber, my followers from outside the Philippines was really, really very interested of what I'm saying. So I'll try my best. I hope you will understand and it will help your better understanding of what I'm saying. Because this is scientific and highly technical. So that's one reason. And also, if there is some irregularity on the prostate, inside the prostate, your libido will be affected. The erection will be affected. Especially now, there's a lot of people, 80% of people was vaccinated. There have some serious on the libido drop. There's a lot of men affected, and it's a wife and husband issue, it's a problem. Sometimes less than 60 or 50. There's a problem of impotency. Sometimes they're in the middle of, sex usually lasts 3 minutes, 5 minutes, or maybe some is really a young person, maybe sometimes go 7 minutes, But sometimes they cannot withstand in a long, more than maybe 1 minute only. There is erection, but maybe 1 minute, it's no more. Oh, that's really a problem because of that. Especially if there is a tumor. Sometimes no response at all. The erection is disappear, and that's a big problem for the husband and wife. So we will solve this one because I treated more than 4,000 prostate issue. Some with cancer. Cancer, maybe I'm talking more than 1,000, Some is just enlargement. So you need to be checked. The size and the weight of this, the weight, something like 20 grams, more or less. I don't know, but more or less on that range. But if your prostate weight is, let's say, 30, that's maybe 27, now you have a problem. And the PSA is a prostate test, laboratory test, from 0 to 4. That's the score, that's a marker. That's why you need to test your PSA. But from my experience, the patient, even me, because I'm 71 years old, I'm one of the, source of this also problem. And also I was vaccinated from COVID vaccine. But since I'm a scientist, a doctor, and naturopathy, I solve it and it's no problem. So through experience and the experience of many patients, na-solve ko yung ano na yun. Marami. Susunod lang kayo sa akin. The existing medical technology regarding the prostate issue, let's say there's a lot of synthetic drugs, but based from the medical journal, they admitted and found out that the natural is more better. Let's say the success rate on treating prostate by means of medication or oral intake, is 25% success, but the natural is 75%. Like what's inside. On this bottle, this is Prostalib. This is supplement to help, food supplement to help the health of the prostate, especially the enlargement and etc. No? And also the libido problem. There's a lot of men now, husband, there's a lot of, but some erection problems, some is emotional and some physical. Before, some is just emotional. But after the COVID vaccine, now it's physical and emotional. What I mean emotional? That affected the erection. We talk about the emotional. Erection mean in every human or any husband or man, you need a lot of concentration on that. Like, let's say I'm lifting this thing, you know. I'm just lifting. I just used a very small effort from my hand and a little of my brain, you know. But for erection and coming out, ejaculation, that's a very, very comprehensive effort of your whole body to give the best performance on the sex. Emotional. Let's say emotional. Let's say husband and wife. If you have some financial issue and you have some issue, really you discuss, and like there is a big discussion and with the shouting match, your erection will be affected. No, how you call it? Walang gana sa sex sa mag-asawa. That's the emotional aspect. Pero kung wala kayong problema, no issue, yes, you can perform better. Ano? No prostate issue, no problem. But when, let's say, forget the COVID vaccine, before, I'm talking before, emotional problem to create erection also contribute a lot. Let's say, with your wife, sometimes erection, for a long time, maybe you're married for 30 years, 25 years, some people, some men, erection with your wife is not the same as before when you are younger. But some men go with illicit love, affair, cheating. Let's say we call it cheating. That's the nature of the men, polygamous. Especially younger. Let's say a man is 50 years old and there's a young lady 25 years old. The desire, the urge, and the erection is really great. But why? With wife, real wife, the erection is lesser, maybe 50%. Oh, that's emotional problem. Huwag mo nga yun, para hindi ako makita. Huwag mo nang gawin, gawin mo na yan. Oh, that's emotional. But now, there is, pwede pa tayo yun. But now, with this COVID vaccine, a big problem. Almost, even 40 years old, affected by this. Because I'm treating every day. Now, there is a lot of complaint here. There is one patient, actually, I solved the prostate problem because of frequent urinating up to 4 urination a night. And the other one is not a patient, it's just accompanied by the patient. also discussing me, because I'm already 50 years old, discussing me about this erection. So also a problem. So it looks like everybody has a problem with the erection and with the frequently urinating. Oh, really, it's an issue now. Kaya that's why I want to discuss to you in details how to solve it. So I discussed to you about why men have some UTI, urinary tract infections. And also, what we are discussing now, I want to make more details. The sign, because not all of you can go to the laboratory or doctor for checkup, But I'll give you the sign for you to be aware. One sign that I gave you before, that almost not yet unzip your pants and the urine is going out. The control is not much, Not like before, it's normal without the issue on prostate. You can urinate and then, and sometimes there's, we call it leakage. After urination, to stop, there's a problem. Sometimes you stop, but there is also still coming out. So what happened? Your pants, some already wetting, some is wet. And that's a sign of a prostate issue. Forget the enlargement first, or tumor. But that's the sign that you need to solve that problem. Indication. Sometimes hard to urinate, but hard to stop. Sometimes when you think you are urinating, but you are not yet in front of the bowel, since you are controlling it, the control is not much, it's already leaking. That's why there's a lot of men now, the pants is wet, and there's a problem on prostate. That's a simple information that you must be aware. There is a lot of problem. I have a lot of prostate problem, cancer patients. Sometimes they come here included with the pillow. They cannot sit without the pillow because it's really hurting. That's also a sign. Let's say when you are sitting, there is some pressure or pain in your testicle. And it means there is a sign that there is enlargement. So the doctor, sometimes what they are doing, they massage. We call it prostate massage. The doctor will insert, look, the finger here with a glove, and then try to, because this is large bed. Look very near, this rectum surface. Once this is enlarged, go here, so you can touch it, you can feel there is an enlargement already. So they massage it slowly, but sometimes they force, and create bleeding. Sometimes it helps, but I don't recommend it on that way, So what the best thing to do? But we go to the normal practice. Sometimes they use, we call it Bracken therapy. And you can Google it to avoid us discussing more larger, because what I'm saying, it's, but it's very expensive. We're talking about, how many? $7,000. This treatment, $7,000 to $10,000 in some countries. But here, I think $6,000 to $7,000. So that's the medical treatment. But in Abiso Wellness, based from my experience, that because I treated a lot, many thousand, some maybe more than 1,000 with a tumor, like this, there's a tumor already, not only enlargement. Here, what we're doing here, first, detox. Again, the same thing. The same procedure, the same thing. First, detox the body. If I said detox means comprehensive detox, we detox the gut until to the rectum. to the colon, from small intestine to the large intestine. Remove that any toxic hidden there or stuck. That's why some of my patients complaining why after moment. Please share this video and subscribe. And to those my followers residing in US, because I have my subscribers start to increase somewhere in US and in Indonesia, Malaysia, and some in India. Actually, I checked it last night. Before, my followers subscribing in YouTube is just 80% Filipino, and the 20 distributed 7% in US, and some is in Asia, Malaysia, Indonesia. But now it means representing 20% only. But now it's changed. My followers in YouTube outside the Philippines is 60%, 40% on Filipino. I don't know. It's keep changing, but that's what's happening. So what we are doing here, cleansing. The blood, like, again, I keep repeating, please share it to some other. Once you have the problem, okay, moment. I just keep repeating this one, but since I have a new subscriber, I am forced, nothing we can do. Although you just hear it, and I don't want you to be annoyed, but I'm telling you, we need to give information also to the new subscriber. The blood should be like this. But if you have a problem with nutrients deficiency, your blood is start to get black, and that's toxic already. The blood flow will be restricted. The blood must be distributed, the nutrients, the oxygen, and everything 7 times per hour. But once the nutrients, you have some deficiency of mineral nutrient, that's what will happen. It will become black. The toxic will increase, and all type of diseases, you are subjected to that. Like, toxic blood, pwede kang magkasakit ng maluba katulad ng stroke, cancer. It depends on your body, but all kind of diseases because it's traveling, Our body, we call it immune system, we call it a soldier. This is constantly needed mineral nutrients. That's why the diet, kailangan 90% prutas gulay, from my estimate, from my own experience. 5% carbo, 5% protein. You might increase that 5% and 5% into 30, 15, but if you are really a hardworking person and keep sweating, you need to go until to that. Especially athlete, you can go maybe 40%, 30%. But if you just doing a light, you just eat a lot of meat and rice, and then you sleep, and that will become a problem. The chemistry of the blood, since there is no sufficient mineral nutrients, it will become acidic, and then your existing remaining mineral, it will oxidize. That's why antioxidant was invented. So, again, I will repeat, detox first. Detox the blood by bloodletting and blood cupping, and detox the gut, especially the colon and small intestine. And then detox the emotion. Emotion. Sometimes people keep thinking about their health on another problem. You need to treat the emotion because emotion affect our therapy, affect our health. Why? Look, just especially old people, old person like 50 years old. Kapag nag-iisip tayo palagi, babagsak yung ano, yung nag-aalala. Hindi isip, okay yan. Pero yung nag-aalala, distressing, and then it create anxiety, and then depression. This will affect our thyroid hormones production from the thyroid gland. Thyroid hormones is very important on the composition, good quality of the blood. It will become sticky. Our heart, we have some hard time of pumping the blood. That's why an old person, or let's say 40 years old, just thinking of one problem, later on, just keep thinking and you have anxiety and depression, and they will feel some chest pain. Why they experience chest pain? Well, because of the difficulty of the heart muscle to pump it. That's only the reason. It's a hydraulic principle. So you understand why old persons sometimes, if they're thinking too much of a problem that lasts 2 weeks, 3 weeks, and they have this heart breathing and some chest pain. So that's the important. That's why we should treat the emotion side. Forget the emotion. What we gonna do? We cannot give additional extra life to our body kapag isip tayo ng isip. Kaya kalimutan na, lahat naman tayo mamamataya, kahit ako, baka mauna pa ako sa inyo. So that's one way, you know. And then, giving proper nutrition. At the same time, like, first, because of we are doing this, putting the quality of blood in a very good condition to remove this many problems, especially prostate. The blood must be like this. Ito should be, ang kailangan ng hemoglobin is really rounded. It's like full of air, like wheel, and not touching each other. The more separated, the better. And good size. Because some hemoglobin is shrinking because of the blood thinner, because of the synthetic. Because the blood thinner, it will shrink. Let's say the blood is close to each other. When you drink the blood thinner, it will shrink. So there is some loosen, lumilid ka, nagkakaroon ng loose, kaya nawawala ang high blood. Pero hindi dapat ganyan. Dapat the same size, good size, and then without touching each other. It means that's healthy. That's my blood, actually. I'm 71 years old, and that's my blood. I don't have synthetic maintenance. I'm not an athletic or go to the gym. No, I don't have any exercise. My exercise is on, this treating people, pulling the leg, pulling the hand, Oh, so we need a supplement that will give us mineral nutrients from the natural, from the plants, from the tree, from the flower, that we need to take. Because our body components is from the soil. Galing sa lupa, that's based from the Bible. I hope everybody is, I don't know in Muslim, if they believe ang human is from the soil. Creation of the human, base sa Bible. I don't know, in Quran or Hindu, or I don't know, but I'm talking about the Bible. Men from the soil. So immediately we should think, naturally we should think, common sense lang. Most of the components of the soil is our body. Some is not, like the toxic one, the heavy metals. So we should maintain that, That's why I'm talking 90% fruits and vegetable. Rest is the carbo and protein, the meat and rice, something like that. Because we need that rice, carbo, because that's our gasoline. And then meat is for muscle and feel strong. So, almost all, based from my experience, I'm talking myself, through experience, 49 years, I'm a scientist, and I'm doing naturopathy for the last 49 years. Inventor. Most of the plant, I discovered most of the plant created by God. There's a function in our body. There's a contribution in our body. Even you see street flowers or something in a path or in the mountain, the forest, there is a lot of this. That's from the soil. Diyan na kinuha sa soil and then filter the heavy metal and then we just eat the flower or the leaves. And we need that. Now, this is supplement dedicated for the blood. To make this blood like this. This is the delivery system. At least if you don't have a problem, at least something 25 to 30, something like herbs a day. Or every other day, you must take that one. To replenish the oxidized mineral nutrients. Also, okay? So, this one, you must take it forever in your life because it's very convenient. This is 8 herbals, there's 6 herbals. There's with FDA, and this Prostalib, this is for prostate. Nutrients, food supplements for prostate needed to avoid the enlargement, to maintain the libido. But this is food supplement. This is not drugs or whatever. God created all of this for our body, and that's why I'm showing you from true experience. I discovered what's this inside the prostate. Sopalmento. Ano pa? Fulvic acid. I forgot, but I will show you later. I will read it here. I will. Because I have several herbal and keep forgetting it. Oh, yeah. Tribulus terrestris, ginseng, maca, silagit. Silagit, that's the fulvic acid. Sopalmento and pine pollen. That's what the ingredients of this. I emphasize this one because this is our topic, the prostate. This will help you. Will help. This is not drug. This is natural. This is not Viagra. But it will help. Don't take Viagra. There's a big side effect. You will die on that if you don't know how to use it. And sometimes, no effect. You keep using it and then later on, no effect at all. When you used to it. And this one is the herbal tea. It's dried, different leaves, bark, roots, different. When you are, let's say, you just to supplement your body with mineral nutrients, this is the one. Sometimes it's composed of 14 different herbal, very important herbal. But if you are sick, you have may prostate na kayo, or high blood diabetes, it will go 20 different herbs plus, depend on that. That's why, if you order mineral, you must give us some of your complete blood count laboratory test, CBC, and some other tests, and give up the history of what you are taking before the herbal, because that's very important to us. You need to tell us, inform us the history of what you take before to avoid familiarization on that particular herbal. Marami kami natulungan. We help a lot. We're thousand. Some, kahit even not coming to our clinic, better if you come to our clinic because we can detox you easily, very fast. That's why high blood and diabetes here, no issue, especially if type 2 diabetic. In less than 5 days, or maybe, let's say come here, you have diabetes and high blood. When you come back, you'll see, oh, I don't have any high blood anymore. Very, very quick. That's why we consider it's not a disease anymore. It's just like a simple fever. Very fast. If you're suffering from that and you're taking a lot of synthetic for how many years, and we can, once I found out that you're improving, gumagaling ka, and then just taking what I think, including this one, and then later on, I'll check your blood color, and the hemoglobin, and then I'll start to advise you to reduce the intake of the synthetic until it will disappear. So you don't need to take it more. I hope you understand what I'm saying. I'm forced to say it in English, although I'm not. This is not my frequent language with my patient. This is not my mother. Tamos is Filipino. That's why I have sometimes I forget things. Although inside my brain, but to convert into Tagalog is quite some difficulty. So I hope you understand. That's why I'm forced to do this sometimes in English. Maybe later on I keep saying, but the problem, I have a lot of patients which is in Tagalog. But YouTube can help us, from Tagalog to English. The only problem is 50% only accurate of what the YouTube is saying on English. But later on, I will keep saying it is in Tagalog because I have a lot of... actually, I've done it already, but this is the first time I keep saying more percentage of 90% is in English because I have a lot of requests from outside, from the Philippine subscriber. So I hope you have some question, but I'm only the one here. I cannot see your question, so I will stand and go to the... you will not see me while I'm reading your question. So please throw a question and then fire a question, and then I will try my best while we are here. Maybe we have maybe 15 minutes before I cut this live stream. Ha? Pwede kong makita rito? Sandali, ha? Ito, may live chat. Okay. Wala pa naman. Sige. So, throw a question, I will try my best to answer you. What time now? Now in America, it's already too early in the morning. Maybe there's some... Because I have a lot of inquiry question in America. That's why I made this video in English form. But they're already 2 o'clock early in the morning. By the way, very strange. So hindi ko... the viewers here, but in my video, there's more than 40 viewers. But anyway, it's keep changing. But anyway, so what I will discuss, I will answer the question, what is the question last night and this morning. And I discussed this already, how to do it, very simple. And try to avoid buying herbal from online. It will give you, most of the time, it will give you a problem. Because some people are selling online not in a proper condition. Sometimes they're selling it not properly dried. The moisture content is more than 10. So it creates molds. When they pack it in a plastic and then 3 days, 4 days, that create molds. And sometimes spoiled already, rotten already. So be careful on that. It's not good spending money. And then, since there's a lot of herbal, you cannot perfect it. You need a lot of time to do it. But since I'm doing it by package, because I build a very big dryer room, to dry it properly and test the humidity to make sure it will maintain the quality of the herbal. Kaya, yun ito, pag-aralan nyo, mag-ingat kayo dahil maraming na minsan, pagka natuyo na yan, hindi mo na makilala kung talaga ba yung kasi sa picture, iba yung picture ng fresh, iba yung picture ng dried. Kaya, mahirap ma-identify. Kailangan nyo, kung may supplier kayo, it must be honest. On my side, kasi matagal na ako rito, 49, I'm protecting my credibility. I will not cheat people. It's not my line. It's not my thinking. If I can help and then earn money, that's what I like. So I hope this video give you some information about this prostate. Tomorrow, I will check because just this morning, 2 hours ago, my live stream took 1 hour and 22 minutes. I think it's almost 1.5. And there's several questions on that. Based from that question, and tonight I will check. I will check it. So I can discuss it tomorrow again. Tomorrow is Saturday. I don't know if I can do this live stream again. So ganun na lang. Mag-ingat tayo. And nasabi ko kung may tanong kayo. So isasara ko ito. Meron pa akong 7 minutes. Dito, to treat our body is very simple if you know how to do it. Like what I'm saying to you now. Simple lang. God did not create our body to make us confused. And very simple. Just follow. First is do the natural way. And that's the priority. Yung natural, this is the primary healthcare. Itong ginagawa ko, what I'm suggesting is the primary healthcare. Yung boost your, make sure your mineral nutrients is well supplied to your body. And then how to check what's the sign inside your body about this prostate, to avoid this prostate cancer or enlargement of the prostate. Nagbigay na ako ng mga sign na dapat yung tandaan, kaya kailangan na mag-ingat tayo dahil ang daming may problema yan, hindi lang sa Pilipinas, sa buong mundo, lalo na nung nagkaroon ng pandemic, nagpa-injection kayo, tapos hindi tama ang diet. Tuturo ko sa inyo kung anong dapat na diet. Pag order na kayo rito, magkakaroon na tayong communication, bibigyan nyo kami ng mga kahit na hindi kayo makapunta. Kaya ako ginagawa ito doon sa mga hindi makapunta rito. Tuturuan ko kayo. Ito, ma-order nyo sa amin to. Itong tatlo. Natural, Oxy, and Prostalib. And then yung herbal, kung sa Pilipinas, masusuplayan ko kayo. May FDA yan yung tatlo. Sa Pilipinas, masusuplayan kaya. Kaya sa ibang bansa, hindi ko kayang garantiyan. Other country, I cannot guarantee that I can supply you this herbal tea. So, maybe I will advise you. That's why you need to coordinate with me. So, we'll give you what herbs. Maybe inside your kitchen, one herbs, some of this you can easily buy. But we just keep coordinating until you make, better health. And especially the libido, your sex life will become happy again. Even you are already 70 years old, even 80, still can do a good sex life, husband and wife. So, tama na siguro ito. At I will check tonight kung ano yung topic natin. Ang mangyayari nito, actual therapy, and then kung ano yung mga inquiry, sisingit ko ito. So, please subscribe, subscribe, and then share this and like for me to grow. And hopefully, I will earn. I am not earning in YouTube. Hopefully, I will earn, and I can contribute doon sa mga patient natin na a poor patient cannot afford to buy nutrients. I might donate some of my earning if I will earn. At this time, I'm not earning. But it's just in a few, maybe in less than 1 week, I will be monetized because it's less than 300 already. Less than 300 hours I needed. So it means something 3 live stream, hopefully 3 live or 4 video live, and then I'll start to earn money on that. I hope it will give a good money so I can donate some to my poor patient here in the Philippines. So please share, like, and subscribe to my channel. Thank you very much, and God bless you.